Hello juniors, so I welcome you all again in the continued series of general anatomy, and today we are going to cover an important topic, yet an easy topic, which is the classification of bones. So today's topic will be an easy, short, concise topic, but there are some misconceptions in the students regarding the classifications of the bone. So I clear them also. So starting with the today's topic, and there are 206 bones in an adult human. So bones in the human body are majorly classified into five types. So bones in the human body are majorly classified into five types, and the classification of bones is based on shape and function of the bone. You can see here I have marked shape and function with the green highlight. So this is the first misconception student has, that classification of bones in humans are based on their size. This is a very big fallacy, that the classification of bones in humans are classified on size. So you have to remember that classification of bones in humans are based on their shape and function. So there are basically five types of bones. So you can see this is a skeleton, and right here I'll briefly summarize this. So the first one is a long bone, second one is a short bone, third one is a flat bone, fourth one will be our sesamoid bone, and last will be our irregular bones. So we'll be covering them one by one. So starting with the classifications of the bones. So our first type of classification is the long bones. So long bones are cylindrical in shape, and their length is being greater than their width. So if to assign a bone as a long bone, it must be cylindrical in shape with its length greater than its width. So if this is a bone, it must be cylindrical in shape, and if this is the length and this is the breadth, so this width must be lesser than the length of the bone. So there is a big misconception in the students that the term long bone describes the shape of the bone and not its size. Qualifies the criteria of being cylindrical and being longer than wide, it would be considered as a long bone. So for example, if a bone is 30 centimeter in length, and if another bone is only 4 to 5 centimeter in length, and if both the bones are cylindrical in shape and both of their length are greater than their width, both the bones will be considered as long bones. So for example, we have in arms the humerus, radius, ulna. In legs, we have femur, tibia and fibula. And fingers, we have metatarsal and phalanges. So this is the femur bone in our legs. Below the femur bones, we have tibia and fibula. And they all fulfills the category of being in the classification of long bones. Similarly, this is the humerus bone. As you can appreciate, this is a cylindrical bone with its length greater than its width. And lastly, the metatarsals. So this is our first, second, third, fourth and fifth metatarsal and their related phalanges. So if somebody asks you, are the metatarsal will be considered in the long bones? So if a student who is living with the misconception, he will straight away give the answer that no ma'am, the metatarsal are not the long bones because they are only 4 to 5 centimeter. How can they be considered as long bone? But a student who knows the misconception and who knows the exact definition, that bones which are cylindrical in shape and being longer than wide, they will be considered as long bone. So therefore metatarsal will also be considered as long bones, and their related phalanges, these are these will also be considered as long bones. Coming to the function of long bones functions as levers. They move when muscle contract. So showing you this with the help of this diagram. So you must have studied in your physics that this is a lever, this is a fulcrum. Fulcrum basically is a fixed joint, and here is the load. So the long bone basically acts as a lever. So if this is the fulcrum, basically a joint, and this is the long bone. The long bone act as a lever, And when the efforts are made, this effort is perpendicular to the long bone, which is applied by the muscle contracting it. So the efforts help to lift up the load, and in this whole process, the long bone act as a lever, like this I have showed you. Coming to a second classification, which is the short bones. Short bones are cubical in shape, being approximately equal in length, width, and thickness. So be cautious in the definition of short bone. They are cubical and approximately equal in length, width, and thickness. Here the definition nowhere says that short bones are shorter in size. So a great misconception is that the term short bone describes the shape of the bone and not its size. So for example, this is the shortest bone in human body, which are the ear ossicles, namely malleus, incus, and stapes. And if someone asks you, are these malleus, incus, stapes will be considered in short bones? You will straight away give them answer that no, because short bones are classified on their shape, based on their shape, and being approximately equal in length, width, and thickness. And the example regarding this classifications are the wrist bones, which are the carpals, and ankle, which are the tarsal bones. So showing you in this zoomed in section. So this is the wrist bone, also known as carpals. You can appreciate they are a bit like cubical in shape, and similarly in this tarsal bones, these are also cubical in shape, almost cubical in shape. So these are the short bones, and the function of short bones is that they provide stability and support. So these carpals and tarsal provide stability and support, but only a few degree of movement at their location. This is their point to remember. Coming to our third classification, which is the flat bone. Flat bones are thin and often curved with a large surface area. So, as the definition implies, they are thin bones and often curved with a large surface area. So, this is our sternum bone, which is present at the mid of your chest. This is a thin bone, as you can see in lateral view. It's a thin bone. It is curved bone with a large surface area. You can see this is the anterior view and it shows the large surface area. The same implies with the ribs. They are also the thin bones, curved bones, and with a large surface area. And once again with the cranial bones, which are the frontal bone, sphenoid bone, ethmoid bone, parietal bone, temporal bone, and occipital bones. They are basically thin bone. They have a curved appearance. They have a curved structure, and with a large surface area, as you know. So example, we have skull bones, sternum, ribs, and the function flat bone serves as a point of attachment for muscle and often protect internal organs. As you must be knowing, to sternum we have a main muscle attachment known as sternocleidomastoid, and they also act as an attachment for other muscles. Beneath the rib, there is present the lungs and the heart, and the ribs help to protect the internal organs. And you all must be knowing that the skull bones protect our brain. Coming to the fourth classification, which is the sesamoid bone. So our fourth classification is sesamoid bones. So sesamoid bones are the bones that are embedded within tendon and protect them from excessive wear. So what is a tendon first of all? So tendon is a fibrous connective tissue. This is a fibrous connective tissue that connects the muscle with the bone. So here is the underlying femur bone, and that this fibrous connective tissue, this tendon connects the muscle with the bone. So sesamoid bones are embedded within the tendon. So this is the sesamoid bone. This is a famous patella bone, also known as the kneecap. So this bone is embedded within the tendon. So this is the fibrous tendon, and this bone protects them from excessive wear. So you can imagine if there was no patella in front of your knee joint, then there would be no bony shield to minimize friction and stress on the tendon during movement. So once again, there is a misconception regarding the sesamoid bone, that sesamoid bones are S-shaped. In some students, misconception arise that sesamoid bones are S-shaped. So if somebody asks you this is a clavicle, is the clavicle sesamoid bone? You will straight away say them that clavicle is not a sesamoid bone. I've already told you example. The patella is the kneecap, which is the sesamoid bone, and function protects tendon from compressive forces. Now the fifth and the last category is the irregular bone. So if the bone does not fix to any of the categories we have discussed above, the bone will be given the title of irregular bone. So they have a complex shape and don't fit into other categories. For example, are vertebrae and some facial bones. As you can see, this is the vertebrae. You cannot tell any features which are common in regard to the classification we have discussed above. So basically this bone is has three spines and one body and does not obeys any rule of classification we have discussed above. So the function of vertebrae are is to protect the spinal cord, as you must be knowing. And just to summarize all the five types of bones, here is the summary table I have taken from web, and you can see the long bones are cylindrical like shape, longer than width, functions as a leverage, and here are the examples. So similarly, short bones, flat bones, irregular bones, and sesamoid bones. And the way I used to remember all the five types of classification in my first year was with the help of a mnemonic, and the mnemonic was like, I don't like long, short, and flat girls, but strong and intelligent. So completed with the all five classification of the bones. So if you found this video helpful, do like it, do share it with your friends. Thank you.